Good afternoon, everyone. Thank you for joining us today. We are an interprofessional team of two student physical therapists and one student occupational therapist. My name is Norma Colby, and I'm an SPT at the University of St. Augustine for Health Sciences.
And I am Emily Soto Ramirez, also a student physical therapist at the University of St. Augustine.
We are here to present our 3-year strategic plan focused on air quality in the areas served by health partners. Our plan aligns with the Health Partners Climate Resilience Plan and adds emergency preparedness and response, infrastructure resilience, and community health resilience. Today, we will discuss the main air quality concerns, barriers to health, strengths of our interprofessional approach, as well as our proposed goals, strategies, and implementation timeline, and evaluation methods as well. The importance of this initiative cannot be overstated, as poor air quality has significant implications for respiratory health, cardiovascular function, and overall our well-being. So by implementing these strategic measures, we aim to create sustainable and impactful changes that benefit individuals and communities at large.
All right, so breaking down the problem. We focus on two different case scenarios, with the first one focusing on KM, who was a sixth grade student who suffered an undiagnosed asthma attack. This was due to worsening air quality and household mold exposure. Her condition worsened due to environmental allergens, demonstrating the urgent need for better air quality management and patient education. With children, they are particularly more vulnerable to air pollution due to their developing respiratory systems, increased physical activity levels, and great exposure to outdoor air compared to adults. When addressing their needs, it requires a targeted intervention at both the household and community levels. For the second case, we focus on AB, who was a 65-year-old retiree experiencing respiratory issues and social isolation due to wildfire smoke and airborne dust in her rural community. Her reluctance to seek care highlights accessibility barriers and the lack of awareness regarding environmental health risks. With older adults, they often face compounded risks due to pre-existing conditions, such as that of chronic obstructive pulmonary disease and cardiovascular disease, making proactive prevention and intervention critical. These cases just overall reflected the broader challenges of poor air quality, which disproportionately affect children, older adults, and individuals with pre-existing conditions. Additionally, socioeconomic status plays a major role, as lower income households may have less access to clean indoor environments, quality healthcare, and protective measures such as air purifiers. And addressing these issues requires a collaborative and multifaceted approach, integrating education, healthcare interventions, and policy changes.
There are several barriers to health that contribute to worsening air quality related conditions. These include limited healthcare access, financial constraints that prevent relocation or home improvements, lack of awareness about environmental triggers, and even systemic infrastructure challenges that may increase that exposure to those air pollutants. The limited healthcare access is particularly concerning for those rural and underserved populations where medical facilities may be far away, transportation is limited, specialized care may be scarce. So additionally, those financial constraints mean that many individuals cannot afford air purifiers, filtration systems, or necessary home modifications that can reduce exposure to those pollutants in their home. So this is where an interprofessional team approach becomes vital. As physical therapists, we focus on improving lung capacity, our exercise tolerance, functional independence, despite these environmental challenges. So we may emphasize adaptive strategies and patient education. We put stress on that to improve daily living conditions. So for example, we may introduce breathing exercises to enhance respiratory function. We may develop structured activity programs to maintain physical fitness despite the air pollution concerns, and even educate patients on recognizing early symptoms of respiratory distress. That way, when we collaborate with other healthcare professionals, policymakers, and community leaders, we can implement comprehensive solutions that extend beyond the clinic and into everyday life.
All right, so we're going to be talking about short-term and long-term goals. Starting off with the short-term goal, we aim to improve community awareness of air quality risks, enhance patient education, and expand access to the filtration solutions in vulnerable homes and public spaces. Community education programs will include workshops, digital resources, and local engagement initiatives to inform individuals about the impact of air pollution and ways to mitigate its effects. With providing free or subsidized air filtration devices in schools, senior centers, and clinics can also have an immediate impact. Now, in terms of our long-term goals, we are going to focus on systemic change, such as advocating for improved housing policies, implementing sustainable community wellness programs, and influencing public health policies, just to ensure continued environmental health resilience. This includes pushing for legislation that enforces stricter air quality regulations, promoting green building standards, and fostering partnerships between the healthcare providers and environmental agencies to continuously monitor and address air pollution concerns.
Our strategies align with Health Partners' Climate Resilience Plan and include three key focus areas: emergency preparedness, infrastructure resilience, and community health resilience. By breaking our approach into these three categories, we're ensuring a more structured and systematic response to these air quality issues. So, for emergency preparedness, we propose community-wide asthma and respiratory health education. That way, improving healthcare providers' ability to identify and address these air quality related illnesses go hand in hand. This will also include professional training programs, increased community outreach, and the development of mobile healthcare units to provide more accessible services in these high-risk areas. So for infrastructure resilience, we suggest investing in improved ventilation in schools, homes, and healthcare facilities, along with increasing green spaces to reduce air pollutants. Vegetation itself acts as a natural air filter, so improving overall air quality while also promoting community wellness through outdoor activities is a great opportunity. And then in order to strengthen community health resilience, we advocate for local exercise programs in controlled environments, and greater access to home air quality solutions, such as affordable HEPA filters. This can create accessible indoor exercise facilities that allows individuals to maintain their physical fitness without exposure to these harmful outdoor pollutants.
All right, so we're going to be talking about our implementation plan and our timeline. So our plan follows a structured timeline that takes over 3 years to complete, with the first phase focusing on awareness campaigns, early interventions, and stakeholder engagement. The second phase includes infrastructure modifications, home air quality improvements, and community wellness programs. By the third year, we aim to access policy impact and sustainable efforts. Throughout this process, we will conduct periodic evaluations just to ensure effectiveness and adaptability of our interventions. Key resources include partnerships with community organizations, healthcare institutions, and government agencies, just to provide funding and technical support. And collaboration with researchers and technology developers will also help integrate innovative solutions such as advanced air monitoring systems and mobile applications just for tracking air quality exposure.
And then on evaluation metrics and data collection, in order to measure the success of our plan, we'll track several key metrics, including a reduction in air quality related hospital visits, increased patient use of preventative respiratory care, and improved community air quality index levels. These measurable outcomes will help determine the impact of our interventions and guide future improvements that we can make. And then we also have data collection, which will improve, that'll help us improve by involving patient surveys, air monitoring technology, and public health records. By utilizing both quantitative and qualitative data, we can refine our approach a little bit more in real time in order to apply in real life, ensuring continuous involvement.
So, in conclusion, our air quality strategic plan prioritizes the health and well being of vulnerable populations by integrating not only healthcare, but also policy advocacy and environmental interventions. This initiative is not just about mitigating risk, but also about fostering a long-term culture of health and resilience. And just by addressing social determinants of health and ensuring equitable access to clean air initiatives, we are fostering a healthier and more resilient community. This project is just another step towards sustainable change, one that will have lasting benefits for future generations to come. And that's our presentation. Thank you for your time.